people have asked me what Thai yoga massage kind of does, and Jackie's been kind enough to let me demonstrate part of a sequence of what I do with the Thai yoga to help your body and the mobility and the stretching and the chronic pain. So this is my wife, Jackie. I'm Jackie, and we're fixing to get started with Thai yoga, and it is on sale for our March Madness. Woo, go basketball! Hope your team wins. So, as you see, Thai yoga will have your clothes on. You will not take your clothes off. We will keep those on. We will always start at the feet, and you can be face up or face down or sideline, whichever is more convenient for you. This whole program can be tailored for your needs and your needs alone. I know what her needs are, so I'm going to start with a regular sequence that I like to start with. And we'll start by mobilizing the feet. And I'll show you here. You just mobilize the feet. And then we're going to do the same thing. And here in a second, I'm going to show you that we just do it at the same time, actually. Roll and curl those toes under. Get that nice feel. And you come back and kind of just start rolling them out using your palms. And you kind of follow the lines of the bone and the fascia. So we'll start. So we want to get the outside of the feet. We want to curl them. Then we kind of want to start rolling out. And the reason why we're rolling out is, as you see, we're always internally rotated. That's how a lot of people stay. So we want to get those femurs to start kind of having some movement. So by the time we get up there, it's not as difficult or as tender. And so now I'm just going to go up the sides of her legs with my thumbs, and we're kind of going on the medial side, which is closer to the midline of the body, and we're just doing some thumbing, and that is for your sin lines. And whether or not you believe in the sin lines and the energy lines, I'll show you here. All it is the fascia and the muscle that are between your anterior, your tibialis and your fibula, and then your anterior tibialis. So it's just the muscle in between it. So whether you're a Westerner or Eastern medicine, in Eastern medicine, these are called sin lines. And that's why we start at the bottom and work our way up, is because they believe that prana, which is energy, travels upward towards your head. And if you need to spread their legs a little wider, so you can start using your palms on those lines, you can. As you see, she's half asleep already, and I haven't even begun to work. And if this hurts your knees, right at the inguinal area here. And then we come down into here. So as you can see, it's a very, very sensitive spot that we can't really do when it's draped, and they're very tender and very tight because not many workouts or stretches. See, like right here's her sartorius. Her sartorius comes down. It's like a whip almost. It comes down and attaches to the medial side of the knee. So sometimes that can cause knee pain when they're really super tight. And hers, unfortunately, feels like a guitar string. Then you have your gracilis, which is a little deeper, and it runs down, comes underneath, wraps around underneath your kneecap, and attaches to the other side of your knee. So you can have knee pain from the inside of your leg, and you can get knee pain from the outside of your leg because of your IT band and your TFL, which sounds like a cup of coffee, your tensor fascia latte is what I always called it. So we don't want to use a lot of pressure here. So we're just going to palm it. But still also find your vastus medialis, which is a muscle between your quadricep, which is called your biceps rectus, and it's on the inside of the leg. And you want to put your thumbs into right in between those two muscles. You want to split them, and you want to work all the way up into the iliopsoas, which is right at, am I there? Yeah. So right about here. Jackie, can you show everyone with your hand where your no-no spot is? So, can you reach up a little further? There you go. So I'm really far away from her no-no spot. So if I wanted to, I could ask her to cover that up so I could come up here and work a little deeper into those areas that I wanted to get to that don't get worked on. And then we can just roll those out, see? And I don't have to worry about, see, you see how tight those are? I'm not putting any pressure on them. Let's just roll them out. And the only reason I'm on the outside was to show you. So let me start all over, get her relaxed again. So she's stiffened up a little bit on me because that's a very sensitive area. But I can show you a homework to do when you're not here to help get those adductors. And the reason why they're called adductors is because the whole front of your body flexes and the whole back of your body extends. So these muscles are on the front, so they keep you bent while your hamstrings attach to your sits bones, which is your ischium, and they're trying to keep you extended. Your psoas is a deep muscle in your abdomen that connects to your lumbar spine. It's a flexor. So your body and your posture is in constant opposition of each other when it comes to posture. Jackie, how are you feeling? Good. Okay. Pressure okay? Am I rolling out too far? to go slow. We're going to just get those hips to move because we really, really want good hip mobility. That's a lot of our problems these days. But as you can see, I'm not doing it hard. Feels amazing? Thank you. My palms are only on muscle. They are not on any bones. So now what I'm going to do is I'm going to work my way back down. So we work and work and work and work and work. And bring our legs in a little closer. That way I can do her feet again. Everyone loves to have their feetsies done. Especially like this. It feels amazing. How you feeling, Jamie?
It's amazing.
Then I'm going to put her feet together. I'm going to show you, we're going to come down. Then we're going to go up. Down. Now it's time to start some of the real work. So I'm going to start, see, look at her feet. If you can't tell from that angle, she's a little off. So this foot externally rotates better than this foot, which makes sense because she's had an ACL reconstruction on this leg and it's always very, very, very tight. But what I'm going to do first is I'm going to give her this neat little trick that works on her nervous system. I'm going to give her some traction. Then we're going to start with some movement. And what this does is this works on your central nervous system. Your body is always in the parasympathetic nervous system, which is our fight, flight, freeze, flee, or the other F that you can't say. And this tricks your body into going into the autonomic nervous system, the parasympathetic, which aids in digestion. It slows everything down. It releases that cortisol that stresses you out. So massage therapists don't just work on rubbing you or putting lotion on you. They work on your fascia, which is your connective tissue. They work on your central nervous system. There's so many things that we can do to help our clients in chronic pain. So now that I feel like she's totally relaxed, how did you like that? She can't even talk really. So what we're going to do first is I'm going to bend her knee. And I'm going to push it as far as it'll go up to her buttocks. I'm then going to move this leg out so I have some room. What I'm going to do here is I'm going to start with her gastrocs, which is her calf muscles. And I'm going to lean back so I get a little stretch out of this too. And what I'm doing is my fingers, where my fingers are at, I'm splitting the gastrocs to get to that deeper muscle on the inside that doesn't get worked very often. It's the one that looks like a heart shape when us ladies wear high heels and makes our legs look beautiful. freely fall. And now what we're going to do with this leg is we're going to lift it up. We're going to give her a nice stretch. So I'm going to put her in my pocket, which is right here on my thigh. We're going to come back a little. And I'm going to say, Jackie, can you give me a little push? Good, release. And then we're going to go back a little bit more. Then I'm going to say, and I'm going shoulder to shoulder. Jackie, can you give me another little push? Good job, let go. Oh, awesome, look at that. I got to go a little further. Now I actually got to move. Jackie, can you give me another little push? Oh, release. Good job, look at that. Then we're going to do the shot put. How does that feel, Mia? Keep going? Okay. And as I do this, it gives me a chance to feel the tightness in her hamstrings before I get to her back. You good? Yeah, your body won't let me go. So her hamstrings are very tight. So now what we're going to do is we're going to start over. And we're going to go from this knee to that shoulder. Okay, Miss Jackie, push, let go. Oh, good job. Push, let go. Awesome. Do one more. Good, let go. Then let's shot put up again. Yep, and see now that we're rotated a little bit, that's as far as her body's telling me it'll go. So your body will tell me before you ever will where it can go and where it can't go. So then we're going to put her leg back down, and I'm going to put it in a tree pose. And what we do here is we'll always use some bend. As you can see, she cannot put that knee down. So that means her hips are absolutely tight. So I'm going to make sure she's comfortable while we do this by bolstering her. And then we're going to work just like we did. You doing okay? How's that pressure? Okay. And I'm only on this side, so I'm not in the way so you can see what I'm doing. But usually I'm over here doing it. So I can kind of put my body into it and roll. And you'll see it on this side here in a second. It'll look like a wave. How you doing, man? A little tender there. Too much pressure? Would you like me to back off?
That was just a tender spot.
Okay. So you heard her. Make sure you have constant communication with your therapist. She immediately said, "Oh, that's a little tender there. Let's back off." You know. So make sure whoever you're working with, you trust them immensely. That way you can tell them, "Hey, I'm not really digging this. Let's stop." and as you can see, I'm just in between her vastus lateralis now and her quadricep. So this is 3 muscles of your quadriceps that come down to your knee as well. And like I said, it looks like a wave. You'll see it on the other side because I can't do it over here unless I get underneath. Ooh, ooh, your hamstrings. Yeah. into a Thai yoga massage, you want to wear something more tighter.
More tighter?
Yeah, pants that are more tight and that don't move as much.
But this was going down to.
So that way, and I promise you, I'm not anywhere near her no-no spot. See? That's way over there. So I know it looks like it is, but I'm not. And my wonderful school taught me the no-no spots. Because there's nothing else to call them but that. Those are spots that we do not touch. No, no, no. Okay. So now that I feel some nice relaxing in there, I really like that.
Oh, God.
I'm going to go a little further up here on her hip. And then as I see, this hip starts coming up. So we're going to kind of do a hip rock. And as you can see, you can get in whatever movement you want to get in. Position. So as you see, my legs out, it's anchored to the floor. My arms are stacked, shoulder over elbow over wrist. I'm in no pain whatsoever. I feel my body feels good. So for you therapists out there watching, easy to take care of your body. And see, we're starting to, I can feel her hips finally starting to let go. So now I'm going to bring her leg back up. I'm going to remove the bolster. These little blankets are great for that. We're going to come back. And once again, I'm going to go ahead and do her calves. Split them so I can feel that soleus, which is a heart-shaped looking muscle. So it's real pretty. I know it sounds crazy, I'm saying muscle is pretty, but it is. And this feels amazing too, by the way. And then I'm going to move her leg back up so I can traction her hip a little bit more. And I don't use the word traction, but I use the word mobility and movement. See, look at that. I'm able to just, she has so much more free movement now than she did. I love it. And then these pants get in my way because they slide and I can't get a good grip on them to give her some movement. Ma'am, are you feeling any movement in your hip? Does it feel good? Feels amazing? Okay. Now I am using a little bit of muscle here. And then I'm going to take, we're going to do some range of motion. I'm going to take it out. And as you see, I have a hold of every joint in between those areas. And we're going to do some hip circles. And then we're going to go the other way so I can see how that works. And she's going to tell me if she feels any pain or if she feels anything whatsoever. That was tight. Okay, so now see, we're doing a little passive range of motion, passive movement. She's letting me do all the work, which is what you're supposed to do. She has to be like a little noodle. So now I'm going to guide her leg out and switch foot. And then it's going to be like a wave again. Ma'am, how's that feel?
Feels amazing.
Do you like the balls or do you like the heels?
I think the heel on that one.
So you see, she switched to the heel in this direction because that's maximum pressure whenever I use my heel. What about right here?
Feels good.
And then we just kind of, we're going to move. Move all that muscle. And as you can see, I kind of move around a little bit. It all depends on how your body is built. So like I have a short torso and long legs. So I'm always readjusting. But it's always to where it's for my benefit, to where I don't get hurt and I don't have to have any overuse of my body. But I'm making her feel amazing. How's that feel, ma'am?
Mm-hmm.
So now, as I still hold, I'm going to put your leg on the other side. And this is kind of where it gets a little dicey. As you can see, she's already starting to breathe. Ma'am, I'm going to ask you to put your arms out to your sides, please. We're going to start out slow, though. But we got to do the outside of your legs. So, we're going to start out here. Working your way up. See, I can't feel anything because of her pants. Okay. See, and for her, the outside of her leg is very, very tight. So her interior tib in between is very, very tight, the muscles between them. So I might even palm press a little bit just to make sure, though. I asked her, how does this feel? Does this feel okay? Okay. Doesn't hurt? Or on a scale of 1 to 10? 0? Okay. And then, like I said, we're going to skip the knee, but we're going to get after we just gave some deep pressure there, we're going to do some little circles with the kneecap and kind of, once again, trick that nervous system because it's going like, well, you were just kind of being a little intense and now you're being all nice. I don't understand. Then we're going to kind of start palm pressing the outside or finger pressing. You can come up and it'll give you more oomph if you want to palm press. And I'm going to work my way up to her greater trochanter, which is basically a hip bone. And it is where her femur goes into the joint. That joint is called the acetabulum. So we're going to start going right there. So as you can see, it's actually kind of important to know your anatomy, or you could hurt somebody real easy if you didn't. What? So now I'm down here, right at her greater trochanter area, right where her glutes are at. So the part that I'm actually on is called the glute medius. And it's about the size of a slice of pizza. It is responsible for external rotation, internal rotation, picking your leg up, putting your leg back, bringing your leg out to the side, bringing your leg back towards you. So abduction, adduction, flexion, extension, rotation of your hip. So it's a very, very important piece. And it connects down into your femur, your TFL, which is your, like I said, that coffee word, tensor fasciae latae, and then connects to your IT band and comes on down to your knee. So you can see how even your glute area, which is your buttocks, can make a difference in your body. And since this is a little bit painful for her, because now, as you see, she's looking away from the camera with her eyes open, and she's just like, you focus on your breathing, and then I rock you to try to trick your body once again into a distraction technique. And I am only like touching her this hard, like you would hold hands with a friend or pet your dog. I hold hands with some of my friends, but we're weirdos. So I'm just stabilizing some of that hip area. Working that glute medius. And I asked her, ma'am, would you like me to go a little bit more center into your glute maximus? Okay, so as you can see, I push her a little bit. How does that feel, ma'am? Does it feel good? Okay. Would you like a little bit more pressure? So she just asked for a little bit more pressure. So what I do now is I grab a hold of her arm and I use my heel. And I do a little bit of the rocking. And I grab this so I don't go fall away. And then I ask her, ma'am, can I see that top leg? Can you move it back here towards me? Oh, thank you. Then I ask her, how does that feel, ma'am? Would you like more pressure or less pressure?
Less.
Okay. So now I'm just using scooch neck. And I'm just giving just a little bit more pressure. Now if you have knee problems, we can't do this. Or we have to do it in a very gentle way. So ma'am, I'm going to ask you if you want to put your leg back over. There you go. And then I'm kind of ask her if she would like me to work her sacrum area. Okay. So the sacrum is a triangle area, and it actually is the source of a lot of lower back pain that comes from your hamstrings, your glutes, and your psoas muscle. Because what did I say they were? They were in constant constant opposition of each other. How's that feel, ma'am?
Feels good.
Feels good? Would you like more pressure?
Sure.
As you can see, that's why I kind of have to hold her. Let me see this bottom leg. There we go. That's just for me to hold on to. Or I can come in with my knee and I can rock her on my knee. Or I can rock her with my other knee while I'm doing a little bit of 3-point movement. I call it something else, but I just remember. How's that feel, ma'am?
Feels good.
Feels good?
3-point contact.
Hmm?
3-point contact.
Yes, I'm using 3 points of contact. So I'm on her glute medius, I'm on her sacrum area, and now I'm kind of just doing a little bit of pec minor work, doing a little bit of shoulder action there. So we've done some work there. Now I'm going to ask her to put that leg back out. We're going to roll back over. And we're just going to, now look at her. Do you see where one side looks bigger, looks longer than the other now? That side is way high, and this side is like nice and lengthened. That's what we're going to do to this side. So now you actually get to watch me. So I start over actually, and I just do a quick up the leg. We don't do the whole sequence quite as slow now, but we do want to get that movement started. Skip the knee, have some circles. There you go, ma'am. How's that feel? As you can see, it looks like a wave. I'm just using a wave. And I'm in no distress. My knees don't hurt, my back don't hurt, my arms don't hurt. Nothing is really hurting me. And she's just getting that wave, deep compression, relaxation. Man, that's a very tight muscle you have there.
Yeah, it's very tender.
Is that from your ACL reconstruction? Okay, we'll take it easy right there. And how many years ago was that, ma'am? 5 years ago? Okay. So you always want to get that good history. You always want to talk about whatever's happening. And like I can feel it. It feels like a guitar string. See, we're just wave movements. And she would let me know right away if I was using too much pressure. So if I went like this, see what's going to happen? But what's the word we use?
Stop. Back out.
Back out.
Stop.
Back out means I just come out a little bit so I can keep going. But if you say stop, I will stop. But back out means that's too much pressure. Let's do a little less. Then we go right back to the hip. What we did with the hip. We want to mobilize them. Just like we did on the other side. digging me doing that. So now we're going to do the same thing. We're going to put her leg in this bent position, get it as close to her buttocks as we can, put our knees there to support that joint. I know my pants keep kind of going it. And we're going to put our hands right in the middle. There's two muscles that are superficial and one muscle that is really deep. And we're kind of just going to let those feel that we're here. And we're here to help you relax. Because a contracted muscle is a tense muscle. We don't want that. We want all lengthened to be relaxed. Now, if you're working out, you want your contractions. And then as you can see, I'm still doing some mobilization to the hip. Ma'am, how's that feel?
That's good.
Does that hurt your hip? Okay. So now, just like on the other side, I'm going to ask her to bring her leg up. Find my pocket. We're going to go knee to same shoulder first. Okay? So, and I'm going to ask her to give me a little push. And release. Oh, looky there. Sometimes you're going to have to hold their leg in, or it's going to fall out. So hold their leg in. Push. Good. Release. One more time. Release. Where's your breathing? There you go. So deep inhales will rush oxygen-rich blood through your body. Long exhales will lengthen those muscles. And this is as far as her body says that I get to go. This is, I don't get to go any further. So we're going to come back down. We're going to get back into place. Now we're going to go knee to opposite shoulder. So I'm going to ask Jackie. Jackie, push. Good. Look up. Jackie, take a deep inhale. Push. Exhale. So did you see how much further I got to go down? One more time. Look at that. That was amazing. And once again, that shot put, that's as far as her body says I can go. Then we're going to come back down. See, I'm still supporting all of that leg. Now we're going to do some of the circles. And assess that hip mobility. Ma'am, how's that feel? Feel like there's a catch right there? Okay. We'll work on it. Right here? Okay. So now we're going to go back to tree pose on this side. And always have your bolsters close by. So I'm going to do it on this side so you can see what it looks like. I am going to kind of do some distracting work real quick. So it's just like a wave. And if I wanted to do both palms, I would. How's that pressure, ma'am? Is that a little deep? Okay. So I'm right here on to move way much easier. I can also rock. And if I want to get shoulders over elbows, over wrists, I can. Just remember, stay away from that knee area. Ma'am, how do you like that?
It's good.
It's good?
It's
Is it good or is it good?
It's great.
How's that feel, ma'am?
Great.
Are you Tony the Tiger now? Yeah. So now, we're going to do what we did a minute ago. We're going to remove the bolster. And I would really get to see what we were doing. I should have started just with this side anyway. So I always start, like I said, with my feet on the outside. And that's to keep her leg. I'm in control of her leg. She is not. I move her leg. This is all me. And once again, my long legs. And then we're just going to kind of just do a little bit of compressions. Do you like the knee, man? The heel? Or do you like the pads, ma'am?
The heel.
The heel? Okay. Ooh, I bet that was a nice surprise. Now, I'm going to take this foot and I'm going to lay her leg on top of it. And now I'm using this foot. And now look at me. I'm just going to sit back, let this foot. Ma'am, how's that feel?
Feels good.
Feels good? How's that pressure?
It's perfect.
Do you like the rolling of the heel or do you like the toe pads?
Toe pads.
Toe pads, okay.
Toe pads.
See, there's that muscle. You can see it trying to make me get off of it. So as you can see, this is just really deep compressions, or as compressions as deep as you would like. And you can be as comfortable, therapists, or as uncomfortable as you want, I guess. But I like to be comfortable. So I'm going to go up a little higher though. And I know she doesn't like this spot. But it is a spot that I'm going to give you homework for, like I said. And I'm going to show you how to do it yourself. Because there's not many exercises that work these inside muscles right here. And so, see that? Jackie, will you tell them how bad that hurts?
That actually feels amazing.
Oh, does it?
Yeah.
Well, I'm not hurting her. Thanks, babe, thanks.
Feels good.
So then, this is when we come over. And what did I say we were going to do? We're going to work the outsides of the legs. We're going to palm press. Ma'am, can you put your arms out to the side, please? There you go. Can you take deep inhales and long extended exhales? Yeah, there you go. Give that little knee some little I don't use my thumbs. And if I wanted to also bolster her, I can with my leg. So I can like use my leg to make sure it doesn't move. I'm going to rock a little bit because I know this hurts. And then I'm going to show you that little slice of pizza on the glute. It's right where this pocket almost looks like it's being stupid. So, here is her femur, right there. Here is her greater trochanter. There is the glute medius. Oh, and this one on this side is so tight. It's like taking up the whole butt. So, since it's that tight, I'm going to kind of come in here and work from both sides. And as you see, I'm supporting her with my knee. Oh, and see, she has this huge knot right here. Like, it's massive. And whenever I say knot, I really mean fibrotic tissue, like an adhesion. So this little spot right here is not letting this leg, which we already saw how her hips looked, didn't we? It's not letting it rotate well. It's not letting her move well. She can't flex it very well. She can't do a lot of things with this leg sometimes because of that. So what I'm going to do now is, since I want more pressure right there, I'm going to put my foot there. And I'm going to ask her to hand me her top leg. And that's just so she doesn't run away from the pain. No, I'm kidding. I'm kidding. But, and I'm not bending or anything. I mean, I'm not really moving it. But I am moving her glutes. So we're not doing a twist. I'm not twisting her. I am just putting my foot into her glutes. We do twists, and they are available, and I do them for a lot of people. And the one thing you have to ask is to make sure that they do not have any herniated or bulging discs in their lumbar section to do a twist. So, ma'am, would you like your sacral? Your sacrum worked a little?
Sure.
Yeah? Okay, can I have that look back? Thank you. So I'm going to put my foot on her sacrum. Ma'am, can I see that arm? Or just put it on my leg and hold yourself. Wow, that arm has no mobility, does it?
Nope.
Okay. So we're not on any bony processes. But this side right here, like I said, this one is a doozy to work. I would get up and then roll. And believe me, she would tell me if I was giving her too much pressure. But she's fallen asleep now. Ma'am, how's that feel? Can you say something for the people?
Feels good.
It feels good? Where are you going? Okay. Let's roll you back over. So that's kind of it with our bottom sequence there. I stop right about here and then we skip over to the back area. But that's going to be for another day if you're interested. So that's the lower part of a Thai yoga massage. As you can see, my client is now asleep. And I'm going to have to wake her up. And I'll just grab her big toe and like, hey. So, also, let me show you one more thing. Say they don't like their feet going down. You can bring their foot up, put your elbow on it. I don't know if you can actually see me, but straighten your leg out, please. No, it wasn't as big as your knee. So now I'm just kind of bending and using my elbow for that really good spot in the middle, that meaty area that always hurts everyone or gives people some plantar fasciitis. It's never a good thing. And as you can see, her face, she's not hating it. So you can always do that. Sometimes their legs will not bend. That's okay. So anyway, like I was saying, we have lots of options, lots of things that we can do, and I really think that people would benefit from this type. Thai yoga massage is all about chronic pain and mobility of your joints and movement. It increases synovial fluid in the joints to help with movement. It's a great modality. You get to keep your clothes on. So there's like no turnover time. It is a 2-hour massage though. It takes 1 whole hour to do the front and 1 whole hour to do the back. So during March Madness, I have given a promotion for $20 off a Thai yoga massage. So I hope to see y'all, and I gotta wake up my client and tell her it's time to go home because she can't stay